You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Marty Burtner. Dr. Burtner is the founder and owner of Carolina Oral and Maxillofacial Surgery. We've invited him on the program today to discuss who's a candidate for dental implants. Dr. Burtner, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, you're an oral surgeon. Oral and maxillo, am I saying it right? Maxillofacial surgeon.
Yes, correct.
What is that? Tell me about the training involved there.
Well, to become an oral surgeon, you have to become a dentist first. And basically, after becoming a dentist, then you go on to advanced training to become a dental specialist like an oral surgeon.
So moving on to today's topic, who's a candidate for dental implants, what you need to know. What kind of patients are you seeing that are getting dental implants?
Randy, I see patients of all ages. As far as how old can you be for a dental implant?
Yeah, how old
what's the maximum age? There's really no limit. What
are some of the older patients?
Probably the oldest patient that I've placed implants on has been late 70s, early 80s.
Okay. Why would somebody that age, 80 years old, even though it's young today?
You'd be surprised. I mean, I see a lot of, and most of those patients are women, and they come in because maybe their spouse is now deceased, and they have friends and folks that they'll go out with, and they're looking to establish new relationships, and they don't want to walk around missing teeth whereas before with their spouse, they were very comfortable wearing dentures or whatever, and now it becomes a very uncomfortable thing because they're becoming a little more socialized. They're interacting with other people and trying to, in some cases, get back in the dating scene.
Now, one of the things you said is that, for implants, dental implants, you could secure a denture. Is that right?
Yes. Actually, you don't even need 4 implants. You can do as few as 2. And a lot of the restorative docs that I work with, they would prefer to have 2 implants.
Is that right?
Well, yes.
Because, going into this, I think, you count your teeth. I'm thinking that's a lot of dental implants.
Right.
For the denture wear, but that's not the case.
No. Most patients, when they have dentures, the lower denture is always the most problematic. And for the lower denture, 2 implants can be very, very beneficial. It can help stabilize that denture tremendously. And most people, that's the most frustrating part.
You say people compromise their diets, like the denture wear.
Absolutely.
Elaborate on that.
Well, you'll hear patients come in and they'll say, well, I haven't been able to eat an apple, or I can't bite on corn on the cob and things like that. Those are the types of patients that in fact, when they've been wearing dentures for a long time, they just forget about those foods because they can't eat them, and they'll have to just cut them up and things like that. They can't just eat an apple like you and I would.
Okay. What are the different categories of dental implant patients you see?
Randy, I see all sorts of patients. I see the traditional one tooth that's lost. The patient is looking for just a single implant. You see the patients that they've had a bridge for a very long time, and now one of the teeth has failed, and the bridge is going to have to be removed. They've got to go into a partial. And then there's the folks that they've had all of their teeth, and now for some reason, due to decay or periodontal disease, they're going to lose their teeth, and their dentist has basically condemned the teeth, and they can't accept the fact that they've got to go into a denture.
So they have to make a decision between a denture and dental implants.
Right.
Okay.
And then you have the patient that's been wearing dentures for many years, and they get to the point where they've lost bone, the dentures don't fit anymore, they become very frustrated, and they're looking for something to make their denture experience easier and able to live a normal life and eat a normal diet.
My mother, anticipating this interview, talked to her about this, and she's 73. She's been wearing dentures since she was 28. She says, Randy, I told her, because on the phone you say that 70 is not, is a candidate, and she says, I'm too old for dental implants. Is that a common thing you hear, or a perception out there that?
Not really. I mean, as far as age goes, I really don't have patients coming in and saying, am I too old for dental implants? They don't want to accept to them, they're not old. They're ready. They're going to live forever. They want dental implants. They don't want to compromise anything. But in your mother's situation, what has happened is when you're missing your teeth and you're wearing dentures for a long time, you tend to start losing bone, and you lose that denture support, and they become very frustrated.
So if she's been in dentures that long, do you think she could still be a
Oh,
candidate?
absolutely.
Okay.
Yeah, because you know, in a lot of cases, there's still adequate bone to be able to place enough dental implants to give her some support. And if there isn't, then you can do things like bone grafting and things like that to build up enough bone for the dental implants.
So backing up to the one tooth.
Yes.
Why would somebody with just one tooth want to go with a dental implant as opposed to traditional dentistry?
Right. And as you can imagine, most patients that lose one tooth, they're probably some of the younger patients. And this is the start of something that they see as very dramatic. You know, oh my gosh, I've lost a tooth. What am I going to do? Well, you know, their options are basically you're either going to wear a one tooth partial, which is a very cumbersome thing for most people, and young people aren't going to accept that. Or do a bridge. And with a bridge, you basically have to compromise two teeth.
What do you mean compromise?
You've got to prep the two adjacent teeth, which means you're going to cut the two adjacent teeth down so that they can accompany a crown that's actually attached to a prosthetic tooth in the middle.
So a dental implant, I mean, is definitely the better way to go?
Well, yes, absolutely.
I mean,
in fact, in a lot of cases, dental implants have become the standard of care. And a lot of people can actually get themselves in a pinch if they don't actually give the patient that option. And a good example would be a young patient comes in, they were involved in a traffic accident or a sporting accident, bicycle, whatever, they lose a front tooth. They have no fillings in any of the front teeth. They come into the dentist, and the dentist doesn't give them that option for a dental implant. That's not good.
Do you hear that, by the way? They say, how come never, you know, I was really never offered.
Occasionally, I think it's getting better.
So nationwide.
I think it's getting better. A lot of dentists are becoming more in tune to dental implants now. The nice thing is for a patient like that, they can maintain the two adjacent teeth, and the dental implant is a self-functioning dental prosthetic device.
How important is it, by the way? Because you say that there's the person, the surgeon that places, and then there's the person that puts the tooth cap on it. And we talked to and you say you should look for a surgeon, an oral surgeon. You this so important? Because there are general dentists that are doing both.
Right.
So tell us about that.
I think that in most cases,
you think, hey, they should go to an oral maxillofacial guy?
Well, I do, of course, because I am an oral surgeon, but I think that when you have someone that's trying to do everything, you know, it's hard to be good at everything. And when you talk about someone that restores dental implants, because
what does that mean, restore?
Restore means building a tooth on top of the implant. The implant is basically a screw that's made out of titanium that goes down in the bone, and
it seems pretty straightforward, though, by the way. Putting in a dental implant.
Yeah, when you look at it, the basics, I mean, you could train anybody to screw in a dental implant in the bone. It's, you know, a great analogy is you can drill a hole in a piece of wood and put a screw in. When you look at it from that standpoint, it's not much different. But where implants become very critical is the way that the teeth function together, the way they fit together. The implant has to be in the perfect position. If you get a bad dental implant placement, then the whole case is shot.
Is that right? Does that
happen? It does. It does.
And I've had patients come in.
I've had patients come in where they've gone and they've had dental implants placed elsewhere, and the implant has either failed or it has.
What does that mean, failed?
Fail means you lose the implant. You lose the screw. It doesn't fall out, but you end up losing bone around the implant and you start having problems. If the implant is not placed correctly or restored correctly, then you can run into those problems. And that's why I think it's important to, you know, implants should be a team effort. And usually it is.
With the general dentist, you say?
Absolutely. You've got to have a restorative dentist and you've got to have a surgeon. The surgeon is the person that's going to actually do the surgery to place the implant, and they're usually going to work hand in hand with the restorative dentist. A lot of times the restorative dentist
When you say restorative dentist, they're the one putting the tooth.
They're the one building the tooth. The restorative dentist is the general dentist that's going to be building the tooth. A lot of times they'll work hand in hand with the oral surgeon from the standpoint that they'll even make a model of what they want that final tooth to look like, and you have to go by that and place the implant so that he can indeed reproduce that. A lot of the general dentists that are out there placing their own dental implants, you know, a lot of them are very, very good at it because they've been doing it a long time. But, you know, I think that when you have kind of a team effort going on, I think that you get an overall better.
It seems like
better,
a very painful procedure.
You would think so. I mean, when people think about cutting on
bloody
bone,
procedure.
drilling a hole in the bone, you know, patients always kind of cringe when you tell them that you're going to drill a hole in the bone and place this screw down in the bone.
Do they complain about pain? Is that
They
something?
don't. It's amazing.
Is that right?
It's really amazing how you can, in fact, most of my patients are patients that will come in, the general dentist has referred the patient to me to extract a tooth, and then we go on to discuss what we're going to do to replace the tooth. So a lot of my patients are repeat patients where they come back to have the implant placed after we've done the surgery to remove the tooth. And most of those patients, they'll actually state that it's actually less painful than when they had the tooth extracted.